Hello, I'm Dr. Carolyn Coker Ross, and today I'd like to speak with you about binge eating disorder. You may not know much about it, but binge eating disorder is part of the spectrum of eating disorders. It is a real medical condition, and it has a lot of significant effect on people's lives. Binge eating disorder is the most common eating disorder, and in fact, it's more common than anorexia and bulimia combined. What makes me a specialist on binge eating disorder? Well, in 2008, I wrote one of the very first books on binge eating disorder called the Binge Eating and Compulsive Overeating Workbook. I treat binge eating patients in my practice on a regular basis. So how do you know if you have binge eating disorder? Well, some of the symptoms include eating alone because of embarrassment about how much you're eating large quantities of food in one sitting, usually within a 2-hour period, eating large amounts of food when not physically hungry, eating until feeling uncomfortably full, and eating much more rapidly than normal. Many people start binge eating after a traumatic event or as a result of childhood trauma, abuse, or neglect. There may be a genetic predisposition to binge eating disorder, and also binge eating disorder can run in families. Just like the other eating disorders, those individuals who have binge eating disorder can suffer from many medical complications, including diabetes, high blood pressure, sleep apnea, and many more. What stops people from getting help is their shame and embarrassment. What I'd like for you to know is binge eating disorder is a medical condition. It's not your fault that your eating is out of control, and willpower will not cure binge eating disorder. If you've been suffering with binge eating disorder, you may have found that it's affected your relationships, your ability to go out and eat with friends or family members. You may have started isolating because you're afraid of eating in public, and there may be other ways in which binge eating disorder is affecting your life. If that's the case, it's important for you to know that you're not alone and there is treatment for binge eating disorder. Treatments include newer medications on the market, as well as therapy that can help you overcome your binge eating disorder and regain your life. If you're ready to get treatment, if you're ready to end the binge cycle, please call my office and learn about new treatments that are available.